Yes.
It's a
I am
pleasure.
so I am so used to see Joe sir in the car that today I feel that he
Yeah,
has
yeah.
reached home at time.
Now I am in Wayanad.
Okay, sir. That's great.
Don't worry.
Now just reached in Wayanad. Just
Why not
reached
the
in
program?
Wayanad.
What is the program in Minor?
വയനാട് ഫാമിലി ആയിട്ട് വന്ന
Oh, I see. For how many days?
നാളെ കഴിഞ്ഞ് മറ്റന്നാ രാവിലെ.
Sir, we have now started on YouTube Live. So we will be
Yeah.
starting the program in another 1 minute or so. So the YouTube Live has been started, sir.
Yeah, very good.
नहीं उनका लूंगा बीच में
ജോസ് തലശ്ശേരിക്ക് വരുന്നില്ലേ?
ഉണ്ടാവും.
ഏത് ട്രെയിനാ?
ഉണ്ടാവും.
ഏത് ട്രെയിനാ?
ഞാന് മലബാർ 6-8 അവിടെ എത്തുന്നത്.
ആ ഞാനതിൽ
തലശ്ശേരി.
I also coming by the same
Okay.
train.
Good evening, Singarolu sir. Good evening. How are you?
Fine, Samir sir. I wish that. Probably.
Sorry, my.
Good evening, Samir.
Good evening. Good evening.
സിഞ്ചന ഗുഡ് ഈവനിങ്. സൗമ്യ
Good evening, sir.
Sinchana, good evening.
Good evening, sir.
Good evening.
Good evening, everyone. Good evening.
Dr. Sinchana,
Good
good
evening,
evening.
Samir,
Good evening. Yes.
last week you are in Trivandrum. You are coming
Yes,
to
yes.
Trivandrum. Yeah, I
Enjoying
saw your
Kerala.
photos. I saw your photos.
Enjoying Kerala hospitality.
Yeah, very nice.
Yeah.
Always pleasure for us. Your presence.
We were together, Josh.
Yeah.
Mike
Dr.
sir,
Yeah.
Singarolu
Singar is also there. Okay.
And also Himabindu was
Yes.
also there. Himabindu was also
Yeah.
We have decided to
Yeah.
celebrate together.
Sir, we will be starting now.
Yeah. Now 9 o'clock is.
Sir, we will be starting now. So, good evening, everyone, and namaskar from IAP Allergy and Applied Immunology chapter. A very warm welcome to all. I myself, Dr. Neeraj Gupta, I am currently the chairperson of the chapter and representing the chapter. So today we are celebrating food allergy awareness during the entire week of Food Allergy Awareness Week. Globally, this particular week, which is celebrated for creating the awareness, spreading the awareness regarding various types of food allergies. And we also thought that in our country, now food allergies have started coming up and they are probably the next big threat to us. So let us start educating all the community. So that is why we have kept this first webinar as a public webinar. And in this, we are also going to launch a very important information in the form of a food allergy awareness flyer, which will be like launched at the national platform about the food allergy awareness. So first of all, I would like to invite our chief guest of the day, Dr. T. Sukumaran sir. Sir is the former chairperson of IAP Allergy chapter, and he is former president of Central Indian Academy of Pediatrics also. Sir is a renowned pediatrician from Kerala. Sir, we welcome you. Sir, please give your blessings to us, sir.
Okay. Beloved National Chairperson of the Allergy and Applied Immunology chapter, Dr. Neeraj Gupta, immediate past president or past chairperson of Allergy Immunology chapter, Dr. Jose, my beloved friends, Dr. Shingaravedu, Dr. Samir, other dignitaries on the platform, and my dear friends. It gives me great pleasure and privilege to be here with you to participate in the national webinar in connection with Food Allergy Week. I should congratulate our chairperson, Dr. Neeraj Gupta, for doing a lot of academic activities in the chapter. And also I congratulate Dr. Neeraj, Dr. Ubin Narayan Reddy, and also Dr. Danesh, the treasurer, for doing a lot of programs, academic programs for the academy. This is for the first time that the allergy chapter is doing a community program for the benefit of our pediatricians, practicing pediatricians, and practitioners and patients. And I'm very happy to know that we are going to launch a flyer in connection with food allergy. As you know, the prevalence of food allergy is increasing. I have done a study on prevalence and allergic trigger factors for food allergy in Pathanamthitta district in Kerala 4 to 5 years back. And I have studied some 1,000 school children to find out the prevalence of food allergy. And there's actually a questionnaire study, and we have seen that the prevalence is around 8 to 10%. 8 to 10% of the school children had food allergy, and the commonest symptom were again abdominal pain, vomiting, diarrhea, skin rash. Some of the children present with wheezing, and some children present with acute anaphylaxis. So that is very common in our children, and multiple trigger factors were found out. And our common triggers were, as usual, the trigger factors were milk, egg, peanut, shellfish, fish, then wheat and soya. These were the common, peanut also, these are the common trigger factors we have seen in our children. So, and they manifest in different ways. There will be mild episode, or they can present with a catastrophic episode with anaphylaxis. So it is very, very, very important that you must make pediatricians aware of these complications, and also you must give enough training for our restaurant people, especially those staff in the restaurant, to not to pick up the allergic food, and they should demonstrate, and they should write down what are the allergic foods that is present in the restaurant, and our all patients, all children should avoid this allergic food also. And also you should give proper training to pediatricians, practicing pediatricians, our general practitioners as well, on food allergy and management of food allergy. And I should congratulate once again Dr. Neeraj Gupta and all other executive board members for taking up this program, and I wish this program all the best. Thank you, JAP.
Thank you very much, sir, for your words of wisdom. And I would like to invite our guest of honor, first of all, Dr. Joseph, sir. So, sir is also the former chairperson of IAP Allergy and Applied Immunology chapter, and he is a renowned pediatrician from Kochi. Sir, you are welcome. Please, sir.
Thank you, Dr. Neeraj. Good evening to all. Respected the chairperson of the chapter, Dr. Neeraj Gupta. Our one of the father of our allergy, Dr. Sumana sir. Our Shigarveli sir, Dr. Samit Alvai, Dr. Devendran Chi, and Mitesh, Dr. Mohit Podar, and Dr. Surendra Ji, and all other Soumya, Sinjana Bhatt, and all the EB members, and all dear friends. First of all, I take the opportunity to congratulate Dr. Neeraj Gupta, Dr. Nara Reddy, and team. The allergy chapter this year conducting a lot of activities, especially as Dr. Sumana sir mentioned. He is keen in interesting in conducting academic activities for the benefit of pediatricians and allergy specialists. Moreover, he is very much interested to motivate our public awareness program on allergy, various aspects. Already he conducted various other public awareness program for allergy disease in our community. So as Dr. Suman sir is mentioned, so food allergy is one of the common allergy we come across our day-to-day practice. Around 8 to 10% of food allergy in our community is concerned, already studies found. And again, the problem with food allergy is always you have to be identified by the and identification is very important, because food allergy can be symptom may varies from minor to severe anaphylactic reaction can occur. Again, child can have food allergy, individual children can progress to excess in this food allergy also can individual anaphylaxis also can occur. So various presentations are there. As Dr. Sumar sir mentioned, basically the common maybe milk, egg, peanuts and shellfish and fish and nuts and wheat and soyas, even though these are the common items. So one of the things here to be, I think the Neeraj, the idea is that just making the public awareness of this program of food allergy to make the allergy regarding the importance of awareness among the restaurant people. So they have the responsibility to whenever the people are coming to the restaurant, they have to be clearly communicated to the items in the food items to be then only they can be identified the food allergy there or not. So again, what are the things to be done when you have to be food allergy occurs in the restaurant. The restaurants will have to be aware about regarding the even the anaphylaxis, how they have to be tackled in the situation, had to be identification and tackling the anaphylaxis very important. Again, this I think this is a basic principle of Neeraj Gupta. It's taking the public awareness program for food allergy because this is a need of our public to identify the need of understanding what is food allergy, what are things to be done, and when we go to a restaurant, what are things to be keep in mind before going to taking a food items. They have the responsibility to check the food content of the food, each food items, whether they have any allergy food items in there or not. They have to be avoided. That is, the avoidance is very important factor to the part of food allergy is concerned. Basically, I think Dr. Neeraj Gupta and team doing a wonderful job. I wish you all the best. Again, I offer wholehearted support for the activity. He coming here 1 year for this activity. So he is doing a wonderful activity for not for a pediatrician, not for allergists, it is also public. So it is he's a gentleman doing a doctor activity. Wish you all this. Over to Dr. Neeraj Gupta for further proceeding.
Thank you, sir. Thank you for your blessings. So now we have a very dynamic person from the city of Bollywood, Dr. Sameer Dalwai. He himself is one of the, I will say, that Bollywood star, and he is pioneer in developmental and behavioral pediatrics. So, Dr. Sameer, you are welcome. Please give us some words of wisdom.
No, namaste, and I have to tell you how impressed I am with you actually. So, good evening, Dr. Neeraj ji. Thank you for inviting me. Our dear mentor and our senior most past president, sir, Dr. Sukumaran, sir. Dr. Jose, my dear friend, who's the past chairperson. Dr. Mitesh, my dear friend. Dr. Singaravelu ji. Dr. Devendra bhai, Dr. Mohit ji, Dr. Surendra ji, Dr. Soumya ma'am, Sinchana ji, Dr. all the other people who have joined today. You know, they say that the eye does not see what the mind does not know. So the first thing about allergy, it is a hidden problem. And immunology and immunological disorders are hidden problems. They are not very obvious. So first, kudos to your chapter for taking up, revealing this hidden disease and the burden of this to the community. Second part is this can be a life-threatening issue, as we all know, and people have lost lives. And what you are doing is really, really saving lives by bringing this up in IAP. But the third point that I want to emphasize, the role of IAP is not to be restricted to pediatricians. It is actually to be going out in the community. And I'm so proud that in the last 2 years, the Indian Academy of Pediatrics, initially under Dr. Basavaraj and then under Dr. Vasant Khalatkar, has taken up this program of IAP ki baat community ke saath. And you, Dr. Neeraj and Dr. Jose, and all of you have taken this in your own hands. And what an important issue that you have communicated with the community in English and in Hindi. And I'm sure you're going to go ahead and the next language will be Malayalam. I'm sure Dr. Jose is already smiling. And I'm sure Dr. Singaravelu sir is there. So you'll have Tamil and you'll have in all languages. Because communicating to the community is the most important job of the Indian Academy of Pediatrics. And we should be marching on forward towards it. Very incidentally, there is another program today which we have started, which is called Zara Hatke, Zara Bachke, where we take topics which are a little off the road, not the typical vaccines or the typical antibiotics. They are a little off the radar, but they can hit and bite the pediatrician very badly. I promise you in the next episode, we will take up this topic that you have come up and we will invite all of you as speakers on that because this is also another topic which is Zara Hatke, Zara Bachke. Fantastic job. Thanks to all of you for inviting me and I wish you all the best and my full support. Thank you.
Thank you, Sameer sir. And I assure you that yes, we have already planned for different languages. So we will be releasing that soon. Thank you. Thank you very much. Now we have one more special guest with us, Dr. Singaravelu sir. So Dr. Singaravelu, everybody knows that he is Dean and Head of the Department, Government Medical College at Tanjavur. So sir, we need your blessings. Please give your words of wisdom to us, sir.
Thank you, Dr. Neeraj, for giving me this opportunity. My good friend, past president, Dr. Sukumaran, Joshar, and Mitesh and Mohit, and my good friend Zamir, Devansarin, Soumya, and all others in the platform. I am sure that for the past 2 years, you have been doing, as Zamir told, extremely well. And the future of pediatrician, I always say, ID all is coming down. Only allergy is increasing. So most of the diseases are going to be allergic diseases where we should focus towards community as well as we have to sensitize all people, which you people are doing extremely well. And Neeraj is doing after taking over that from the day one you got elected, you are doing a lot of good academic as well as community. I support all your ventures and wish you all the best. I don't want to be in between the signs and wish you all the best. And thank you for giving me this opportunity. Thank you all.
Thank you, sir. Thank you for your blessings and thank you for being with us today. It is a very important day, and being with you and your presence actually gives a lot of weightage to us, sir. Thank you, sir. So now I would like to invite Dr. Mitesh Kakkad. So he is the main player of today. So Dr. Mitesh Kakkad is one person who is senior pediatrician, who is director of Neo Children Hospital, Ahmedabad, Gujarat, and he is really been instrumental in today's program, and he has done really, you can say, like crafted each and everything. So he is going to speak about a little about food allergy awareness in community. Dr. Mitesh, you are welcome. Please start.
Sir, slide visible? Sir,
Yes, everything is good. Everything is good.
good evening. I would like to congratulate IAP Allergy chapter for celebrating this Allergy Awareness Week. I thank Dr. Neeraj sir and team for making part of it. So we see common belief in society that many parents and patients tell that I am suffering from allergy of banana, orange, citrus fruit, cake, pastry, chocolate, cold drinks, fermented food like dokla, idli, curd, buttermilk, milk. But the unnecessary avoidance of this food product leads to undernutrition, psychological stress, and impaired quality of life. So world over, these are the common food that causes 80 to 90% of the food allergy. Among these is number one is milk, egg, peanut, tree nut, fish, shellfish, wheat, and soya. The less likely foods also causes food allergy are lentils and chickpea and some of the fruits. So what are the common symptoms? After the exposure of food allergen, the symptoms to start within 10 minutes to 2 hours. Common symptoms are itching, redness of hives, urticaria, swelling of tongue, swelling of lips, sudden onset of vomiting, crampy abdominal pain, diarrhea, started runny nose, watering from eye, coughing, choking episode, wheezing, breathlessness. Sometimes we see unconsciousness and syncope, but these symptoms should be within 10 minutes to 2 hours of ingestion of allergenic food. So, after the symptomatology, we make diagnosis with physical examination and some of the investigation, in which we do skin prick test, prick to prick test, specific IG by immunocap. In selected cases, we advocate component result diagnosis and food challenge test. So what is the role of allergist and pediatrician is to confirm food allergy, either IG mediated or non-IG mediated. Here there is no role of food intolerance test. So after having diagnosis, all patients of food allergy must have this anaphylaxis action plan, in which the name, age, emergency contact doctor number, patient is allergic to what type of food, that should be mentioned, early recognition of the symptoms that we have already discussed, and dose of adrenaline must be in this form. Then position of the patient, supine position with leg elevated, and site of the injection should be mentioned on the picture. So it is an anterolateral aspect of thigh and intramuscular. And there should be a picture of preloaded adrenaline syringe in spectacle box. So anybody who is having true food allergy should carry this anaphylaxis action plan. So if we see the community level, first role of parents. When you take an admission and while having child parent meeting, the food allergic card and anaphylaxis plan should be submitted. Communicate regularly with the teacher about the school allergy policies. Give packed lunch from the home and discourage of the sharing of the food at in the lunch time. And child should carry, this is most important part, child should carry anaphylaxis kit which contains at least two adrenaline pre-filled syringe in spectacle box. And parents should make a habit of reading label on the food pack and no multiple food panel testing by themselves. This is very important. Now, role of school teacher and staff. Educate teacher, cafeteria staff and staff for the recognition of symptoms and management of anaphylaxis. Teach students about food allergy symptoms and no bullying. It is noted that 1/3 of the kids with an allergy report bullying. and discourage food sharing among the students during lunchtime, and designate specific area if possible lunch table for the free from the common allergen. Now, what is the main role of restaurant chef and food makers? Here, there are maximum chance of cross contamination. So, strict hand washing should be implicated. Use color designated knife with different board for cutting and chopping for different allergenic food. Washing of utensil, kitchen equipments, kitchen surfaces and dishes should be done thoroughly, and store different allergenic food, that is nuts, egg, peanuts separately in separate bottles. Now, restaurant travel and parties. As already discussed, carry pre-filled adrenaline injection always with action plan. Ask about their food policies. See menu before you order any food and discuss with manager and chef. Ask detail about what you have ordered, the content of the food. That is very important. And don't assume and don't take any chance every time when you go for the outing. At the parties, marriage function, in big gathering, you cannot ask everything. The best option is you carry homemade food. Try to see the allergy menu at airport, train station, while flying or in the train. This is the picture I have taken, real picture from the Mumbai airport, one of the food joint zones. They have mentioned allergen declaration that if you are having any allergy, you just declare at their table, and food allergy notice. So we need to have this type of standee everywhere, all railway stations, airports, food joints, cafeteria and restaurants. But after all, home packed food is the best option overall. So if you are having one of this food allergen positivity with the history and investigation, this is not you have to avoid that product only. The preparation from that particular food should be avoided. If we see the milk, any form of milk, cheese, ghee, butter, pudding, egg preparation, waffle, donuts, muffins, pasta, bread, noodles, if they are without labels. Peanut butter, peanut oil, nut mix. If you are talking about wheat flour, wheat atta, noodles atta, cakes, muffins, all contain wheat flour. Soya, then soya beans, soya milk, soya protein, tofu, tree nuts, mixed nut, chocolate, pesto oil, fish you have in soup, salad, sushi, dressing, and in gelatin. So if you are positive to any this food allergen with history and you have severe reaction, you have to avoid this product that are made from that particular food allergen. So to summarize, confirmation of food allergy is must with the history and testing. Strict avoidance of the allergic food is necessary. Keep anaphylaxis plan and food allergy uh, card with you anywhere you go, and especially in the school. Carry pre-filled adrenaline in spectacle box. Home packed food lunches at all places is the preferable option. Don't assume that you will get allergen free food at restaurants and while during traveling. Most important thing is sensitization of society for food allergy and early recognition of symptoms are required. Thank you.
Thank you very much, Dr. Mitesh. I think it's a wonderful information which you have given. And the last slide, summary slide, which I really liked, that you have really summarized each and every point to the point in 6-7 points. So now we will release the flyer which we are aiming for today. So I will request you to put the flyer for us.
This is the flyer in English and Hindi.
Great. So on behalf of IAP Allergy and Applied Immunology chapter, I am proud to launch our food allergy awareness flyer in both English and Hindi, a vital step towards educating families, schools, restaurants, and healthcare providers across India and even outside India. Food allergies are not just a lifestyle inconvenience, they can be sudden, severe, and even life-threatening. Though this bilingual flyer, designed in a very simple, visually engaging manner, we aim to spread timely information on common food allergens, early warning signs, emergency response, and preventive measures, making our community safer and better informed. This initiative would not have been possible without the dedicated efforts of Dr. Mitesh Kakkad, who has worked tirelessly to prepare the flyer content with clarity, accuracy, and empathy. We are also immensely grateful to Mr. Sahibal Desai, who is co-founder and chief, executive officer of IAP Allergy and Applied Immunology chapter, at Pet Puja, which is India's leading restaurant management platform. He's an engineer by education. Mr. Desai has been leading growth and product at Pet Puja for last 9 years. His visionary leadership has enabled their software to power operations at approximately 1 lakh, that means 100,000 locations across India and UAE. We are thrilled to announce that Pet Puja has partnered with IAP Allergy and Applied Immunology chapter to help increase awareness about food allergies and to educate restaurateurs and their patrons through this flyer distribution, a pioneering step for public health in the hospitality industry. Let us work together to ensure awareness lead to preparedness and that no life is lost due to lack of knowledge. Thank you for being part of this important mission. And now I would like to invite our special guest of the day, who is Mr. Shaival Desai. I would like to personally thank him on behalf of IAP Allergy and Applied Immunology chapter. Mr. Desai, you are most welcome.
Thank you, Neeraj sir, and respected doctors. Thank you all for having me. It is actually an honor to be on this forum. And so I'll give you a brief about Pet Puja. We're actually India's largest restaurant software, and over 1 lakh restaurants across the country, right from quick service to fine dine and other establishments, use our software, right? So these are the merchants who use our platform on a day-to-day basis. This topic is actually pretty close to my heart. A couple of my cousins have severe allergies, and I have seen firsthand the impact where we had gone to a restaurant. They had clearly said that, this kid is allergic to so and so, and yet he was given the food and had to be given an EpiPen, right? So it is actually a topic that rings home very close. I've also actually been following. So both my parents are doctors, so I've been following, the increase in both diagnosis and occurrence of allergy throughout, right? And we as Pet Puja are going to, enable the restaurants to get this brochure both in a digital format and in a format that is printable to them, and such that not just the staff but even patrons coming in to dine are more aware about allergies and how to prevent these kinds of episodes in a food service establishment. So thank you all for having me here.
Thank you, Mr. Desai. Thank you very much. We understand that I think you're having time shortage and you might not be able to continue with us. So, Dr. Sukumaran, sir, you would like to say something to Mr. Desai now?
Mr. Desai, I should congratulate you for initiating this program. And also, I think I should encourage your staff also to do something to find out the allergic reaction in our children. And also, please keep a list of food items that is there in your restaurant that can produce allergy. Thank you very much.
Sure, sir. Sure, sir. Thank you.
Thank you so much, Mr. Desai. Thank you. Now, as Mr. Desai has mentioned about different problems which can happen with food allergies. And yes, definitely, Dr. Mitesh has also highlighted many of these problems. But we as doctors, do we really understand the voice of the patient? So let us hear from the patients. Let us hear from the patient attendants that how easy or how difficult it is for them. Dr. Mitesh, can you please stop sharing your slides? So with us, we have today few patients and patient attendants or relatives who have gone through this journey, and they would like to share their journey or their child's journey, that how this has happened and the things have really changed. Dr. Mitesh, please stop sharing.
Yes.
Yes. So I would first like to invite Mrs. Soumya. Mrs. Soumya, are you with us? Mrs. Soumya, are you with us?
Yes, yes, Dr. Neeraj. Thank you.
Thank you, Mrs. Soumya, for joining us. So we just would like to know about the difficulties which you faced in your child case, and then how the child's quality of life was suffering at that time, and now where are we and where are you?
Yeah, thank you, Dr. Neeraj and Dr. Nagarajan, who has been our for giving me this opportunity to be part of this webinar. And I would like to say that I can relate to almost everything that is being told, all the do's and don'ts that some of your presenters discussed. So I have gone through almost all of that experience, I would say. So my son is a little over 6 years old right now. And we got to know about his milk protein allergy right after we started solids, around 6 months of age. So it has been a very tough journey since then. Like, first of all, for us to understand how severe an allergy can be, because we have heard about allergies, but I never knew that it can cause something like anaphylaxis, that it is life-threatening for my child. So it has been a very long journey so far, and luckily we have found the right doctors. Our pediatrician, who is also an expert in pediatric allergy, and she referred us to Dr. Soumya. So until then, it was a challenge. Same thing, like he was very young. He was not in set, but wherever we go, if we have to attend at home, we took all the precaution. We knew we stopped using dairy to a large extent, and made sure that we don't even touch him with the hands, that we handle dairy out. We understand that it will become more challenging. We do not eat out too much because of this. The dairy is so common that like a roti can have curd in it, or so many dairy products can be mixed within naked eyes. And the awareness is so low that I ask, is there any dairy in it? They say, no, there is no milk, but it might have some other form of dairy. So we avoid eating out. We make sure that wherever we are invited, we carry his food separately. So all these prepen after the doctor's recommendation, which is again not available in India. So then we had to get it from somewhere. And later I shifted to using these adrenaline injections from the hospital. So it is not, even doctors, even hospitals are not well aware of the severity of an allergy, is what we have realized through this journey. And even at school, right, we had to do a lot of research. We had to go meet the head of the institutions to see if they understand, to see if they can accommodate such a child, if they can take care of his requirements. So there is areas mainly for, like, I can avoid eating out, I can avoid outside food, but hospitals, doctors, medical caregivers, and schools, I feel definitely should know. They should be prepared to handle any instances of allergy. So we started immunotherapy with Dr. Soumya. And I believe we have crossed the stage of anaphylaxis. It might not be life-threatening for him anymore. He is able to tolerate, even want to, when we offer him something with dairy, my son doesn't want to have, because he has such severe reactions. He has like uneasiness, itchiness in his throat, in his mouth, and immediately he feels nauseated and wants to vomit. So it has been very challenging, and lack of awareness in general public and medical caregivers has actually been a big challenge for us.
I can definitely understand Mrs. Soumya, and especially the fact that in India, especially this milk is considered to be the essential ingredient. And if you ask somebody that, okay, you have to stop milk, then it is something like a life sentence for that particular person, or probably for the whole family. Because if the child is suffering, actually the family's quality of life goes down severely. And I can really understand the pain through which you have undergone through that. So this was one case which was the common product, which we call as milk. Let's hear from another parent, Mrs. Swati. Mrs. Swati, are you with us? Mrs. Swati?
Yeah, hi. Can you hear me?
Yes, we can hear you. Please share your part.
Sure. Yeah. So I'm Swati Sethuram, and I'm mom to Akhil, who's right now 13 years old. And we've been on this journey since Akhil was 3 months old. So just to give a little background, Akhil was born in the US, and that's where we discovered he had multiple life-threatening allergies to tree nuts especially. And after we relocated to India, we were very lucky to kind of meet Dr. Soumya, and she treated Akhil with oral immunotherapy. She guided us. So first off, that's made a huge difference in the quality of life for Akhil. I mean, there was so much anxiety about food in our house. I think that's it's kept him a lot safer after that. It's allowed him to lead a relatively normal life, which wasn't possible before. And as parents of child with food allergies, we've had to take a lot of extra care, as Soumya mentioned, right, around food and around handling of food. So traveling has been very stressful. Going to restaurants, even attending social functions, especially where there's ice creams and cakes, birthday parties. So for most part of his young age, we've avoided those places, because it's not just the worry of avoiding the food allergens, it's also cross-contamination. So yeah, I think from a very young age, we've taught Akhil how to read food labels, how to recognize allergy signs, and also, watch out for the allergens. I think, like Soumya mentioned, every year we speak to the school, we speak to the parents, and make sure that we have a plan whenever, if there is any reaction due to accidental exposures. And I think whatever Dr. Mitesh explained in his PPT, those are the exact steps we've followed everywhere. But in spite of all these efforts from our side, he has had a few reactions and one anaphylactic episode due to kind of, accidental exposure. So I think one thing I can recall is we were on a flight to Singapore, and he has anaphylactic allergy to walnuts. So the airlines was serving, walnut brownies as part of their dinner service, and that's a 4-hour flight that we kind of don't want to remember. It was so stressful for us. So what makes things even harder in India, I feel, is there is like a food allergy awareness is very low, even among relatives or even people who have seen what happens to him. They can't kind of understand why it happens. And food labeling is very inconsistent and almost non-existent in a lot of cases. And the understanding of cross-contamination in most places, not just restaurants, even schools, homes, so it is very low. So navigating this space has been like a really huge learning curve for all of us, right? And I really hope like restaurants, food handlers, food manufacturers, they start taking allergies, food allergies seriously, and label their ingredients clearly, understand cross-contamination, and train their staff to have those conversations about food allergies with customers. So yeah, by sharing like our story, I want to kind of help build that awareness and push for safer practices and make like life a little easy for all those families who are navigating this food allergy journey just like us. So having said that, I want to thank Dr. Soumya and the IAP Allergy chapter for giving me this opportunity to share our journey, and also for conducting this public awareness program. Thank you.
So Swati, thank you for sharing your experience. And what I have realized is that on behalf of IAP Allergy and Applied Immunology chapter, I would like to request you and simultaneously to Soumya, both of you, to become the ambassadors of the chapter, patient ambassador. Reason behind, because it is not only the opportunity, it is the responsibility sharing. Let us come together. Let us come together. Whatever your child has suffered, let any other child should not suffer. Let the other parent should understand. So because you might be the lucky one, you too might be the lucky one who probably reached to the right doctor. But there are so many others who are unable to reach, who even don't know that what is happening. And their quality of life, you can just really understand that what is happening to them. So if we have achieved something, let us spread it. So I would like to invite both of you along with Mr. Nitish to become our chapter ambassador, become the voices of our chapter. We will help you, and we ask your support, your help to you can say like disseminate the knowledge as maximum as possible. We would need your support if you are willing for that, and we can together make something different tomorrow for our kids, for our children. So Mrs. Swati, Mrs. Somya, are you with us for this noble cause?
Definitely, Dr.
Yes.
Thank you. Now I would like to request.
I'm really happy that we are getting this opportunity.
Great, thank you. And now I would like to request even another different story. So food allergies not only happen even in pediatric age group, they can actually happen in adult. So I would like to request Mr. Nitish Soni. Are you with us? Mr. Nitish? Nitish, please unmute yourself. नितिश आप मुझे सुन पा रहे हैं तो आप अपने आप को अनम्यूट कीजिए. I think Nitish name is here, but anyway, we will take him in between. He should be around only. Okay. So I think there are certain burning questions. There are certain burning issues which Soumya and Swati, they have brought together. So with this, I would like to keep now the panel open, and I would like to invite my colleagues. Obviously, expert Dr. Mitesh Kakkad. He is from West India, western part of India. Modi ji is Gujarat. So it's Mitesh Gujarat. So Mitesh is from Gujarat, Ahmedabad. And then Dr. Soumya Nagarajan is with us. So she is the leading food allergy specialist from country. Dr. Nayanmani Deka from East Guwahati. Dr. K. Surinder from Central India. And then Dr. Mohit Podar from Jaipur, North India. So what we are trying is that we will try to, you can say, like, have different aspects from the different part of the country. All 5 zones we will try to cover. But even Swati, Soumya, you all are like invited in the panel discussion, and we can discuss. So my first question goes to Dr. Nayan. Dr. Nayan, we have just discussed about food allergies. So what do you think? Means, like, are these food allergies very important, or these are like just very small number, and we are just talking like there is no need for keeping this webinar or this type of awareness program? What is your opinion? What is your experience?
Thank you, Dr. Neeraj, for giving me the opportunity to speak on this important platform. The thing is that although food allergy prevalence is little less compared to other countries in India, but it's not like that. If it is 1 to 2% also, it's a huge burden in our population, basically in our children age group. So it's a burning issue, and gradually, due to change of lifestyles, like Western lifestyles and all, the food allergy prevalence is going to be increased. So although it is little bit less percentage wise, but it's a burning issue, and for the family or for the child who is suffering from this disease, now it's a a very dangerous thing, because at any time the child might develop anaphylaxis, or it might be a life-threatening issue also. So in that situation, it's a very important issue for that family or for the society also. So it's a burning issue, and that needs to be sensitized to all individuals. So we should be aware, we should be more vigilant, and the parents should be more aware of these issues. And if such issues happens, they should also report us, or the Indian Academy of Pediatrics, for whatever initiative you are taking. So it's a very burning issue, and it really needs to be addressed very well.
Thank you, Nayan. I think you have really hit the nail at its head that yes, definitely food allergies are increasing, and there are lot many factors. We all have heard Swati. She has mentioned something that the child was born in US and then they moved to India. So Mohit, what do you think? Is there any catch here in this history? Do you really think that related to food allergy?
Yeah, if we look into this whole aspect, then considering the fact that usually when we study about allergy, we study about atopy, and then we look into the genetic factors of it. But overall, when it comes to food allergy, there is a westernization of the westernization has also played a good role. And what we see out here is that kids of the Indian origin who are born in Western areas or Western countries suffer from food allergy much more often compared to India. So there are two aspects out here. One is that yes, considering this clearly shows that there is something, as if it's worth mentioning Dr. Parmesh here, that usually in our Indian food or our Indian culture, most of our food is cooked. So with the cooked food, we usually uh, uh, dilute the proteins, or we convert the proteins into much simpler form, so they are less allergenic. And secondly, the overall scenario with the westernization or with the health hygiene hypothesis and all these coming on, we are seeing an increase in the Indian kids who are here in India also. So this shows that westernization of the food culture is leading to increase in food allergy. Secondly, there is one more aspect which we have to remember out here is that overall in India, we are still lacking in diagnosing food allergy properly. We might see a patient with anaphylaxis. Many a times the parents must be telling us कि इसने ये खाया था, इसने ये किया था, इसने वो किया था. But we would have been overlooking the food part, and we would have been managing the anaphylaxis only. So thereby, what we see now, that what our mind doesn't know, our eyes don't see. That ways, at an emergency room level or a ER level also, the food allergy needs to be sensitized much more, so that the diagnosis of the food allergy is much more common, and then we are able to identify the anaphylaxis in a much better way.
Great, Mohit. Thank you. So, Dr. Surinder, I think Dr. Mohit has brought a very important point about anaphylaxis. We have also heard from Swati and Somya regarding both of their kids have underwent through anaphylaxis. To my understanding, this anaphylaxis seems to be something a very medical term. Can you please explain what is this anaphylaxis means to a common person, so that he or she can recognize, okay, my child might be suffering from this anaphylaxis type of thing. What do you mean by that?
So thank you, sir, Neeraj sir, for giving this opportunity. Sir, anaphylaxis may be the term which may not be appreciated by a layman, sir. But for us, anaphylaxis means child becoming very sick in front of our eyes within few minutes, as Mohit said, and you may be having breathing difficulty, swallowing difficulty, and you may be going to shock. So these are the medical terminology which parents may not understand, sir. But in the parents' aspect, suppose their child in front of them suddenly collapses, or suddenly having some acute problems, where child is in front of eyes, the child is suffering like itching, hives, and breathing difficulty, and sudden vomitings, severe pain abdomen, and not able to maintain his posture. So something going rapidly in front of their eyes, which they can't predict also, sir. Those things, maybe you have to suspect there's something is going wrong. After immediately after an intervention like a food or something, which the parents have doubt about this cause. So then they can attribute it to anaphylaxis. Sir, they have to take immediate step, as Soumya said. They have to. The mother said, no, sir. They should be educated about that EpiPen injection, sir, to prevent the casualty.
Absolutely, Dr. Surinder. Thank you. So what I understand that what you are telling me is that anaphylaxis is something in which something very serious which is happening in a very short period of time to the child. The child was active, playful, taking some food, and suddenly he start having some itching, hives, bumps on the hands or the feet or the face. The eye, the tongue might get swollen up, the lips might get swollen up, the voice might change, breathing might become faster, the child might feel breathless, choking type of sensation. The child is unable to take a breath. The limbs, the upper limbs, the lower limbs, the hands and the feet might become cold, clammy. So that the child might lose consciousness. He might become faint. So probably this is something which is happening. And if you can say like it is happening within half an hour or 1 hour or probably within 2 hours of some food intake, then at that time it might be a possible food associated anaphylaxis. So
exactly.
Dr. Mitesh, there is a question that till now we are just discussing about only anaphylaxis. My question is that anaphylaxis is the only presentation of food allergy, or there are some other presentations of food allergy also, which one need to be aware about?
Anaphylaxis is a severe form of food allergy. Child may present with some local symptoms also, only skin manifestations like itching, rashes, urticaria, hives, angioedema, swelling of lips, swelling of tongue, edema. So this is milder form. And sometimes child have if any mild symptoms of gastrointestinal symptoms, that is diarrhea, vomiting, crampy abdominal pain. But if food allergy is of non-IgE type, means there is no immediate symptoms within 10 minutes to 2 hours, then there are some entities like food protein induced enterocolitis. The causative agents are only food, but it will not cause you anaphylaxis, local GI symptoms, vomiting, profuse diarrhea, shock, dehydration, bleeding from stool. And if it is chronic like enteropathy, then failure to thrive, bloating abdomen, recurrent abdominal pain. So there are some IgE mediated that is causing anaphylaxis, severe form, and non-IgE mediated that will cause usually local form, GI tract involvement.
So that means what I understand is you want to say that food allergy is something like a masquerader. Masquerader in the sense that it can present in different forms. The commonest form, what I understood from your point is that it could be some sort of eczema. Like a child might present to us just with eczema, right? So there could be probably at a particular age, the child has been exposed to a certain food, and after some duration, the child might present to us with some eczema, which is not getting resolved. And the child is using certain creams and ointments and going to the skin specialist, coming back, but the eczema is coming and going, coming and going. Dr. Nayan, do you think that when this food allergy, which is starting with eczema, it just only to the skin, or it can involve any other body organ also after some time?
Yes, it can involve any all organs basically. If there is eczema, there is it has been said that there is transcutaneous sensitization. That means if there is food allergy, that sensitization might happen through skin also. Suppose if somebody is cooking some food and the child is having severe atopic dermatitis, which flare up basically. So in that situation, the certain incidents have still happened that this food, whatever fumes and all these food additives are there, that might come in contact with this dead skin, and after that the child might develop severe anaphylactic reactions. So even though child doesn't take the food, no, through the cutaneous sensitization, child might develop anaphylaxis reaction. So we should be very much aware that in such situation the child should be barred to go in restaurant basically if there is having history of food allergy, or even if there is no history, there should be strict restriction to avoid the restaurants basically.
Great. Dr. Mohit, I have heard a term, I have read in some newspaper, there is a term called as allergic march. Can you please tell me what is this allergic march or atopic march?
Logically, when we see a kid, the atopy basically means genetic predisposition. जहाँ पे heredity में बच्चे ने allergy acquire करी है. Now, in such kind of a case, when we have a atopy, then the child will be having an involvement of 5 major involvements. That is, one is skin, then eyes, then the stomach or the GI system, then the ear, nose, and throat, and then the lungs. Now, if we consider all these, then usually atopic dermatitis is the very beginning thing which we see in a child, and overall over the time we see a progression over from there to the food allergy, allergic rhinitis, and asthma. Of all, here I would like to mention कि many a times we say बच्चा बड़ा होगा तो ठीक हो जाएगा. So basically we need to understand the concept out here is कि बच्चा बड़ा हुआ तो उसका एलर्जी एक से दूसरे में कन्वर्ट हो गया है. बड़ा हुआ तो रियली वो ठीक नहीं हुआ है. This is one thing which we need to understand. And now that we need know the concept of atopic march or the allergic march, we can correlate it well. पहले ये correlation नहीं होता था तो इसलिए ऐसा बोला जाता था कि बड़ा होगा तो ठीक.
So the point which I understand from your conversation is that allergy seems to be affecting practically every organ, and it is actually a systemic disease. It is not localized to only one particular thing, whether it is the skin or it is only abdomen or the intestine. It is actually spreading. Some of the spread is, the common spread is probably the skin, and then followed by the lungs, or probably the nose or the sinuses, something like that. But actually, it can spread to practically every organ. And as I think Somi and Swati mentioned, that it actually can adversely affect even quality of life also. Dr. Surinder, can you please tell me about the common food items in your practice, which you feel that, okay, probably these could be the 4, 5, 6 common food items. You would like to keep your money on these 4, 5, 6 food items.
So the food allergy common is the perception is more, sir, than real allergies to food. So most of the parents, the perception about their food allergies, they name for many foods, sir. Like somebody to say it is banana, somebody say it is citrus. So what, as per literature, the common food allergies are the milk, egg, and tree nuts, and peanuts, and shellfishes. These are supposed to be common food allergies in our setup. And perception is maybe a wide variety of foods as per the history, sir. But they have not been documented properly in the history, sir.
Great. So that means you want to say that actually it is the history which has tell us that, okay, means like whether this particular child is actually suffering from food allergy or it is just you can say like a wrong label of food allergy which is going on. Dr. Mitesh, I have seen many times parents have a habit that, okay, you just get some blood test done. They go by themselves to a laboratory person and then they will ask you, oh, please do my food panel. And then there is some insurance pressure which is going on, some you can say like some panels which are going on tested. So what is your advice? Means like everyone in India should get a food panel tested first and then something coming positive and then going to a doctor. What you want to say?
90 to 95% of the food allergy we diagnose by history only. There is a temporal relation. We have already mentioned all the symptoms, GI within 2 minutes, 10 minutes to 2 hours, skin manifestation, GI symptoms after that particular food, and reproducibility. Repeated exposure to that food should cause these symptoms. Number one, quantity doesn't matter. So most of the time we diagnose by past history, current history, and symptomatology. And then if we suspect, now this, suppose egg is causing a problem to this child, every time when child consumes, he is having within 10 minutes, 2 minutes, 15 minutes having severe symptoms of GI tract or sort of anaphylaxis. Then we go for the some investigation which is very sensitive and specific for the food allergy. Number one is skin prick test. If skin prick test is not possible, we can go for prick to prick test or specific serum IgE by immunocap, that is fluorescent enzyme based immunoassay. That is the most specific and sensitive test. There are some cutoff for that. So if your cutoff is above that level 5, 10, according to particular food allergen, there are some cutoffs. If it is more than that cutoff, the sensitivity and specificity to that particular food item increases up to 95%. So that is important. What you are suspecting in your, there are no role of multiple testing in this food allergy because child is not having 8 to 10 food allergy. You are suspecting 1 or 2. So you do test for that specific IgE or SPT for that food. And we have some advanced test also. If you are confused or you want to predict some severity of the symptoms, then you should go for the component result diagnosis, that is single plex method. You have component.
Great, Dr. Mitesh. So what I understand is that first of all, any particular patient, any particular child, any particular person, if they feel that they could be having food allergy, the first step, they have to reach to a doctor. This is the first step. And then they need to discuss with the doctor and preferably allergy specialist. This is important, right? And then once the doctor will decide that, okay, you do this test and thereafter you do that test. And what I understand from your conversation is that it is possible that the person might be having food allergy, but the test might be normal. It is also possible that test might be abnormal. That means test is showing some 10 food items positive, 15 food items positive, but the child is actually not allergic to that particular food item. So getting a test done and then self-interpreting the test, that should not be done. Even Dr. Google should not be used. It is the actual doctor which needs to be visited. Is it correct, Dr. Mitesh?
Yes, sir.
Great. Dr. Nayan, now suppose Soumya or Swati comes to you or any other patient comes to you and says that, okay, you have diagnosed that, okay, this particular food item has been, you can say like the culprit. You have taken a good history, you have done the testing, you are convinced, okay, now this particular food item is the culprit. So what will be your next advice to the patient or to the attendant?
See, if there is good clinical correlation and good history, which is clearly pointed out that yes, this food is specifically causing the issue. So first and foremost thing is we need to avoid the food basically, And there are certain food items which we can clearly say that certain food items like milk, egg, etc. Their allergenicity will reduce by on due courses like 5 to 6 years. But there are certain foods like peanuts, or crustacean foods where the allergy persists almost lifelong. So that need to be counseled very well. So this point need to be very much clear to the parents that as your child is having this sort of problem, so better to avoid the food items. And because nowadays other options are available like oral immunotherapy, some other options are available, but still in our India it's not up to the mark till now. So until that situation happens, so we should advise the parents to avoid the food items, and whatever way that they should avoid the items. And even if we need to challenge the or confirm the diagnosis, the food challenge test can be done, but that needs to be done in a very good pediatric clinic backup where all the measures can be taken if some reactions happens.
So, Dr. Nayan, what I understand is that it is easier said than done that you just avoid the food item. Okay, we as a doctor, we are sitting in an AC chamber. We just write on a piece of paper, you avoid this. But how easy or how difficult practically for the parents to do that? Soumya or Swati, can you please tell me your experience, how easy it was to avoid the dairy products from your child's diet or some walnut from your child's diet? How easy it was? Soumya or Swati? Yes, anyone.
Yeah, so in my experience, I will say that over a period of time, like I already mentioned, at home, we were able to take all the precautions, we were able to avoid, we were able to completely eliminate dairy, even from our diets actually. But the challenge is when it is time for the child to go out, there is more exposure. Like until now, he just finished his upper KG. I was able to keep him protected. So he went to a small school and we sent him there for 3-4 years. And we made them well aware about the situation. Now when he has to go to grade 1 and I had to look for a bigger school. And he will spend more time with more children. He will spend more time outside. Things are out of our control now. We as parents will not be able to control the food intake, or there'll be food sharing in school. And again, the lack of awareness in schools of how severe the allergy can be. So it is not very easy. Avoiding food to a certain extent and within a controlled environment where I have control, I can. But when it's a growing child, he will go to maybe he goes to school regularly, he will go to meet friends as he grows up, and now he goes for other coaching and stuff. So there are a lot of things, places that are out of our control. So
I can understand,
that
Soumya,
is
and
a challenge.
I can understand, Soumya, and the important point which you have highlighted is that you have also avoided that particular food item from your own diet. That was the point which I wanted to stress out, because it is very easy for us to say, okay, you avoid this particular food item from your child's diet. How it is possible? I am eating something and I'm not giving to the child. Child might take from my plate. So it is possible. So actually that particular food item will be banned, should be banned from the family's diet. And that is actually something which is a family's problem, which is not only the child's problem. And we are actually restricting so many things to the child's
Even
diet.
his social life is not the same as any other normal child. I wouldn't let him go play with other children. I wouldn't send him to anybody else's houses, or he's never left unattended. Even when he goes out to play, like one person has always to be there and monitor that nobody offers him a chocolate or a cookie. So almost everything contains dairy when it comes to children.
Correct.
So it was more challenging for us to make sure that he is safe and that he doesn't, until he reached an age where he could understand that he is not supposed to eat certain things. So we had to be doubly sure.
I would like to invite Dr. Soumya Nagarajan here. So Dr. Soumya, you have been, you can say, like the real person who have actually faced these parents at the first bow. Dr. Soumya, are you with us?
Yeah, Dr. Neeraj, I'm here.
Right. So my question to you is that when, like for an example, Soumya or Swati came to you for the first time, or so many patients who came to you for first time, how easy for you or how difficult for you to convince them? You have made the diagnosis, you have done the doctor job. I am asking a different perspective. how easy for you to convince them, okay, your child is having this particular food item allergy and you need to avoid it. So what do you think? What are your comments about that?
At the utmost, I would like to thank you, Dr. Neeraj, for taking this initiative, for getting this very important subject of food allergy awareness for our patients, their family, and the public, and the food handlers, which is seriously lacking in our society. And I would like to thank Soumya and Swati for joining in. And it would really give us perspective from the patients and the family's perspective to what they undergo. So coming to your question, Dr. Neeraj, how easy or difficult is it to convince the parents to avoid that particular foods? I think I have been one of the lucky ones where I see the patients, the parents are so motivated that they actually, yeah, we have the diagnosis and they have seen the severe spectrum of the food allergy also. And they are willing to go out all the mile to make the child comfortable or the adult comfortable. So it is a big restriction for the family where they are avoiding the food possibility. And even when the labels, when they read that it may contain milk or it may contain tree nuts, I think they tend to avoid all those particular foods. So basically, it is probably I would put it as a living hell for the parents and the patients with food allergies. And because it's not easy when they go out to eat and they have had accidental exposures also. So I think if we all come together to create awareness about especially food handling and the awareness about the food allergic reaction and appropriate management, I think we would really help improve the quality of life for patients with food allergies.
I think, Soumya, you have really done a very wonderful job. And definitely, patients are our result card, report card. And you have come up with these two report cards. And I would like to give more than 100 marks out of 100. I can't give it to you. That is my problem. But I would like to give you more than 100 marks. So, Mohit, here Soumya has brought a very important aspect that she is saying that it was easier for her to convince the patients or the parents. Do you really agree with her? Actually, I disagree because I sometimes face a problem. Like I give some advice, and then next time the patient will come, grandmother was not happy, and grandmother was wanted to give this thing. I have done something like that. I have done something like that. So, Mohit, what do you think? Is your experience same, very easy to convince the parents or something else?
Sir, I am just looking into in between the words of what Dr. Soumya said. She said she has been very fortunate to have Swati and Soumya as their patients who were able to understand the things well and were cooperating with it. Otherwise, it is really not easy. I remember around 18 years back when I started my practice, at that time, if I used to tell any kid, a simple kid with lactose intolerance also, that in this particular kid, this milk should be avoided for 5 days, the grandmothers used to come and they used to come and start shouting at me, ये तो पागल डॉक्टर है दूध रोक देता है ऐसे कैसे बच्चा जिएगा, and those kind of thoughts and processes were there at that moment. Now the acceptance has come. Now what I am seeing is that many a times if the person is coming with diarrhea also, the mothers are already stopping the milk while they are entering the OPDs. So there is a change and people have started accepting the whole scenario overall. So with this, I expect that in future it would be much easier to, yes, explain the parents and to cooperate with them. But this is a wholesome cooperation where the whole family has to sacrifice the food, then only that particular kind of avoidance can be achieved. Otherwise, a child is a child. So if someone is eating cake in front of him and he is told to avoid cake due to any kind of nuts or any kind of egg allergy, it is really difficult. The child may hide and gulp up a small morsel of it also, just in the case of impulsion.
Great. Swati, Dr. Soumya has ever mentioned to you about food diary? Are you aware about something related to food diary? Has she mentioned you something? Can you please tell us about what it is and how you made it?
Yeah, so basically, food diary is something where you kind of note down what the child ate during the day, and then you kind of record, how basically trying to figure out food allergy. Like I said, by the time we came to Dr. Soumya, I think we already had a list of allergies that were known to us, and we kind of went an extra distance. Dr. Soumya even did food challenges for many of them, and then finally we eliminated some of the things. So that way, so that's how we have had our journey with maintaining the food allergy, trying to figure out what works, what doesn't work.
So my question to you, Swati, is that there are two doctors, Dr. A and Dr. B. Dr. A you go, and Dr. A, and both are very good, right? Both are very good, excellent. They are equivalent or probably a little less than Dr. Soumya. Obviously, no one can match Dr. Soumya. So, but they were a little less than Dr. Soumya. So, Dr. A, he has diagnosed that, okay, your child was having this particular food allergy, and he has asked you to avoid this, given you a long list of avoidance, right? Dr. B has also done the same thing. But in addition to that, he has also given you a list that what alternative food items your child can take. So where you feel that you will feel more comfortable?
Yeah, probably I would say Dr. B, because probably they understand that there are certain foods that need to be avoided, but if it needs nutritionally, if the child has to be given those things, there are alternatives for that. So that's where I would go with.
Great. So here comes a question to Dr. Surinder. Dr. Surinder, can you please tell us some few food items that you would like to tell to your parents, to your patients? Okay, you are avoiding this particular milk dairy product. So an alternative to that, you can probably take this thing. Dr. Surinder, some one or two food products, not more than that. Just quickly one or two.
So suppose if he is allergic to milk, sir. So the cow's milk, suppose. So any other milk which has less allergen, like even the goat milk, sheep milk is also, they will be allergic, sir. So compared to the camel milk is less allergic. So they can go for that. Or they can have that milk ladder also, sir. If alternative also, sir.
So what I understand you want to say that it is basically if a particular person is allergic to one particular milk, that means all the animal milk, all the bovine milk, practically he is considered to be allergic. It is the plant-based milk you can
probably. Yeah, soya milk he can give, sir.
Soya milk is probably one of the recommendations. Great.
Yes, sir.
I think so. My last question goes to Dr. Soumya. Dr. Soumya, are you with us?
Yes, Dr. Neeraj.
Yes. The last question is to you now, and then we will finish off the panel discussion. So your advice for, you can say like for school or for restaurants, like for an example, if a school principal comes to you and your advice that what should I do in my school to, you can say like take care of food allergic children. So some piece of advice to school principal or school staff.
Yes, a very relevant question. I think it's important that take allergies seriously. Never downplay anybody's medical condition when they're telling that they have a possible food allergies. We have to educate the school teachers and the school staff to appropriately recognize possible food allergies and manage it, and also sensitize the other children or the staff regarding the food allergies, how there must be barriers, what they can share or what they cannot share, and school readiness program where they are equipped enough to deal with any possible allergies. In fact, I go to a few of the schools where a few of our patients with food allergies study, and we educate the parents and the teachers and the medical team, as well as the canteen people, about the possible food allergy symptoms and how appropriately to manage it. So I think, given that we are increasingly becoming aware of the food allergy diagnosis and prevalence in our society, I think it's a very important decision to educate our school caregivers, where the children spend most of their time during the day. So I think it's a very relevant public community awareness program we have to continue.
Thank you, Dr. Somya. And I think now I would like to thank special thanks to Mrs. Swati and Mrs. Somya for joining us and sharing their practical experiences, because you are the people because of whom we are here. So if you are coming to us and you are telling your problem, then only we can probably come to help you. And thank you, Dr. Surinder, Dr. Mohit, Dr. Mitesh, Dr. Nayan, and Sangarvelu sir. And Nitish, are you around? So I think Nitish is probably not around. So can I request every one of you to please switch on your video? We can take just a quick photograph and then we will wind off.
Dr. Neeraj, before we wind off, I would like to specially thank Swati and Soumya for joining us. I think they had 2 important meetings, but I think they took time out. And really thank you for joining. And please be our ambassadors in helping us disseminate this information for our public and school awareness programs.
Great. Nitish, quickly, can you please share your experience, because you are having a different type of experience.
नमस्ते सर, मेरा नाम नीतीश है, मेरी एज 33 ईयर की है। सर, आज से करीब 3 साल पहले मेरे को घर में फैमिली फंक्शन था। फैमिली फंक्शन के बाद मैंने मॉर्निंग में डिनर करा। उसके बाद मेरी पूरी बॉडी में हिचिंग स्टार्ट हुई। हिचिंग होने के बाद मैं हॉस्पिटलाइज हुआ। वहाँ पे मेरा बीपी थोड़ा डाउन हो गया था। उसके बाद डॉक्टर ने मुझे एविल का और डेक्सोना का इंजेक्शन लगाया। उसके बाद मुझे थोड़ा रिलीफ मिला। उसके बाद सर मैंने एलर्जी टेस्ट करवाया। कोटा के एलर्जी टेस्ट में मेरे सर पीनट्स का, डस्ट का, मेडिकल में अपने डाइक्लोफेनिक एनिमुसलाइड टैबलेट का, इन साल्ट से मुझे एलर्जी शो करा। उसके बाद सर डॉक्टर नीरज सर से मैं मिला, तो उन्होंने रिपोर्ट करवाने के बाद मुझे पता चला कि मेरे वीट से भी मुझे एलर्जी है। सर, मैं केवल इतना जानना चाहता हूँ, जो मैं टैबलेट लेता हूँ उससे मेरे को एलर्जी में कोई भी फर्क नजर नहीं आता है। मुझे हॉस्पिटलाइज होना ही पड़ता है। वहाँ जब मेरे इंजेक्शन लगते हैं, उसके बाद मेरा बीपी भी कंट्रोल में होता है और मेरी एलर्जी भी सही होती है। सर, मैं ये जानना चाहता हूँ कि जैसे मैं कहीं आउट ऑफ इंडिया या आउट ऑफ स्टेट कहीं जाता हूँ, तो मैं किस चीज की सावधानी रखूं? जैसे हर जगह मेडिकल ट्रीटमेंट अवेलेबल नहीं हो पाता, तो इंजेक्शन इंजेक्शन के अलावा भी कोई सॉल्यूशन है जिससे मैं अपने आप को सही रख सकूं सर?
तो नीतीश, आपने एक बहुत अच्छी बात कही है। और नीतीश, अगर हम इसके बारे में बात करेंगे, जैसे हमने आपको पहले भी कहा था, तो जो इंजेक्शन है वो आपको लाइफ सेविंग कंडीशन है, कि जब भी कभी आपको बहुत अधिक दिक्कत हो रही है तो उस समय पे लाइफ को सेव करने के लिए इंजेक्शन लगाया जाता है, जिसको एपिनेफ्रिन या एपिपेन बोलते हैं। लेकिन उसके अलावा कुछ इस तरीके की दवाइयां, जैसे अभी डॉक्टर सोम्या ने भी जिक्र किया था ओरल इम्यूनोथेरेपी, और जो स्वाति और सोम्या ने भी बताया कि उनके बच्चों को ओरल इम्यूनोथेरेपी दिया जा रहा है, तो उसके बारे में हम आपसे डिस्कस कर सकते हैं। बट आपका जो एलर्जी है वो एक अलग तरीके का एलर्जी है, जिसको वीट डिपेंडेंट एक्सरसाइज इंड्यूस्ड एनाफिलैक्सिस कहते हैं। और इसके अंदर हमें वाकई में देखना पड़ेगा कि आपको ओरल इम्यूनोथेरेपी कितना काम करेगा और कितना नहीं करेगा, वो हम आपसे डिस्कस करेंगे इसके बारे में। लेकिन तभी तक वीट और वीट से रिलेटेड जो प्रोडक्ट्स है वो आपको अवॉइड करना जरूरी है। और साथ ही में, जैसे हमने आपको बताया हुआ है कि जो इमरजेंसी वाले इंजेक्शन है, जैसे एपिपेन है, वो आपको साथ में लेकर चलना चाहिए। ठीक है, तो ये 2 चीजें आपके लिए करना जरूरी है। I think we have got a very wonderful session today, and I would once again like to thank every one of you for participation. Thank you so much, and we would once again gather together on another platform on another day to discuss more about the things. So thank you so much, everyone.
Thank you, sir. Thank you. It is a learning experience for us, sir. Thank you.
Thank you.